Good evening, my lovely, and welcome to the Calm Dentist. So tonight, after your pre-assessment for braces, we are going to be applying them. So, without further ado, let's just get right on with it, okay? So, to begin with, can you tell me your name, please, my darling? Excellent. And your date of birth? Wonderful. Now, just going over the questions again. Any allergies we should be aware of? Any medicine that you're on? Okay. Any medical conditions? Okay, and any chance you could be pregnant? Okay, and I think that's all for now. Okay, if there's anything else, I'll be sure to ask you. So, for now, are you settled? Are you relaxed? Perfect. Okay. Well, in that case, I'm going to just start. So, I'm going to pop my mask on and grab my gloves. They've all decided to come out of the box, so that's handy. Excuse the bun. Right, now we'll pop our gloves on. Right, so we're all gloved up, and we're just going to get right in about it. So, you have ensured your teeth are fully clean before you've come. You've followed the instructions. Excellent. Okay. Right, I'm just going to get you in a bit closer so we can see what we're working with. Excellent. Okay. So let me just show you my little diagram. Now we are going to pop braces on all your teeth, okay? So just going to go over them, make sure they're all clean. Let's get my handy magnifying kit out. Oops, sorry. Now, just try these for size. They quite often need adjusted, so bear with me a moment. We shall go with that for now. And let's get my dental instruments set out. Excuse me. Everything's magnified, so I'm going to flip them up for now. Now, I'm going to just start by having a quick look in your mouth. So if you open up wide and say, ah. wide as you can. Excellent, okay. Right. Lay out the tools that I need. Right. So I'm going to just go in gently and just make sure your teeth are as clean as possible. Okay. Right. So let's begin. Put my chair in. And I'm just going to start scraping your teeth. Scrape, scrape, scrape. Just scraping your teeth, okay? Just scrape, 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 scrape. Take these off for now. Just scrape, 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 scrape. Scrape, 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 scrape. Excellent, okay. Now, I've got my braces here at the side. Now, I'm just going to pick one up. And I've got my glue here. So, just going to glue each individual tooth. Bit of glue. And then I'm going to set it with my light. And pop the brace on. And we'll repeat that for every single tooth. So, on to the second tooth. Little bit of glue. Just set it with the light. And pop your brace on. And we shall continue on. Little bit of glue. Little bit of glue. And we'll set them both with our light. And we'll pop our braces on. Now that's 4 so far, and we'll just set them with our light. Set. Excellent, okay. And we're just going to keep repeating that process till all the train tracks are on. So I need you to open as wide as you possibly can for me, my darling. Bit of glue. Bit of glue. Bit of glue. Bit of glue. Okay. And we'll just give it a quick going over with our torch. And let's grab some more train tracks. So, there's one. There's another. There's another one. And let's set them fully. Right, so we'll just give that a moment. So I'll show you what we've got done so far. So far on your teeth we've got this one, we've got these two and these two, so we've got a couple more at the back and then the bottom row. So, in that case, let's continue, shall we? So, I need you to open your mouth as wide as it can go. Now, this is going to be quite uncomfortable, but I'm going to put these cotton pads in between your teeth just to keep your mouth propped open a bit. Okay, there you go. And in the other side, just to keep your teeth propped open. Now, let's continue on. So, I'm going to pop some more glue just on the back left upper teeth. Excellent. Now I'll get my torch and we'll just quickly set it. How's that feel? Any pain? Or is it all okay so far? Excellent, that's what we like to hear. Now, let's get another brace and we'll just pop it on. And another. Now, lucky for you, you didn't need any teeth extracted before we popped the braces on, so that's good because quite a lot of people do. Now we're just going to set them again. Now, bear with me a moment. I'm just going to have a look on your previous x-rays just to see if there's just going to have a peek on your previous x-ray. Okay. Perfect. Just as I thought, all is well, but teeth need a bit of moving, so it's going to take probably 3 years or so of braces. But don't worry, it'll be over in a blink. Now we're going to do the bottom row, so I'll show you my model. We've gotten all of the top bar the last 2 teeth, because they're just, yeah, not necessary, plus wisdom teeth, yeah, they don't tend to move, so. Right, let's pop some glue on the bottom teeth. Perfect. And we'll set that with our torch. So whilst we pop the next braces on, I'm going to tell you a bit about aftercare of your braces. So, as you know, you should avoid foods like toffee and hard to bite things. And sugary sweets too are off limits, as it all gets trapped in the braces and cause decay under them. So I recommend eating a balanced, healthy diet, and for the first week you're probably going to want to eat soup and stuff that's very easy and doesn't require chewing, as your teeth are going to be very sore. Okay, yes. So just bear that in mind. So some examples of foods you can eat is like bread, steamed veggies, tender meat, soft cheeses, yogurt, ice cream and other dairies. I would recommend pasta, noodles, that kind of thing. And fruit. Yeah, so just pop some more glue on the back teeth. Now there will be a slight bit of sensitivity, but it should go away fairly quickly, okay? But still, I wouldn't recommend sugary snacks. And if you are, I would probably brush right after if you're going to. Popcorn is a big no-go because the kernels will get stuck in your braces. So another thing is learning to floss with your braces. This can be quite the task, I have to say. But don't worry, it's just like flossing your regular teeth, but there's a wire in the way, so you just kind of have to learn to work around it. Quite often I recommend to my patients those little interdental flossing sticks, so you can just push it in and out rather than having to try and floss in and around the braces. So now we've got only a couple more braces to pop on. So just the last few dots of glue in the back of your mouth there, and then we'll be adding the wire. Go and set that in place. Set that in place. Okay, wonderful. And let's add the last couple of brackets. Right, so just going to set your whole mouth again, just to make sure that they're not going to go anywhere. And I'll just tap one gently, and if it's going to budge, then we may need to get a stronger glue. But again, I will give you a little thing of wax, just about this size, and if you feel any pain or discomfort from the wires, just pop that on, and be sure to give us a call and we will book you in to get that trimmed down, okay? Now, wires. So, just have to pop them into each brace. And the bottom wire. Right. Now, just going to take those cotton pads out of your mouth. Can you tell me if you bite up and down, are you feeling any discomfort anywhere? Any jabbing in your gums, any poking? And we can sort that out for you. No? Okay, alright. I'm going to just get my fingers in a quick feeling around the braces there. Okay, there is a slight pointy edge on the wire at the back. So it should be okay for now. But if you do experience any discomfort with it, then like I said, use the wax and give us a call right away, okay? Let me just, right. If you open wide and say ah and stick out your tongue, I'm just going to have a final look around just to check it's all going to. Okay. So, all your braces are on these teeth right up until the back, okay? Okay, right, well, I believe it is all looking in top tip shape. And again, like I said, if you experience any pain, then please do not hesitate to get in touch, okay? Yes, 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 of course. Now, so, yes, like I said, you may feel some sensitivity, so just be cautious about what you're eating in the first week. Of course, yes, yes. Now, any questions before we finish up? So yes, like I said, you'll probably have your braces for about 3 to 4 years, depending on how you respond to your treatment, okay? But, anything else? Okay, good question. Yes, like I said, if you experience any pain, soreness, then just give our emergency dental line a ring and we should slot you in right away. Okay, but other than that, yes, just brush twice a day as you normally would. If you lose a bracket off one of your teeth, again, give us a call and we'll replace that ASAP, or the course of treatment will go wrong. So, other than that, I believe that's everything. Now, if you head to the front desk, they'll give you your brace information leaflet and book you in for a checkup in another few months' time. Excellent. Okay, it's been lovely seeing you today, and we'll see you again soon.